for students who are affected by gun violence. You're putting out all of these programs, all of these studies about keeping kids healthy. Keeping kids alive is part of keeping them healthy.
And we're trying to do that by doing the studies to understand why people commit mass shootings.
But you've also cut funding.
And that has not been done before.
You've also
It's
cut
been done
funding.
by the Trump administration.
Sir, I'm going to have to ask you to exercise some restraint. You're a Kennedy. You know how oversight hearings work.
On April 17, 2026, during a House Education and Workforce Committee hearing on Health and Human Services policy, Connecticut Congresswoman Jahana Hayes confronted HHS Secretary Robert F. Kennedy Jr. over gun violence, school shootings, and cuts to programs meant to help children survive trauma. What began as a policy exchange quickly turned into something much sharper, a test of credibility. Hayes wasn't just asking whether RFK Jr. believed gun violence was a public health crisis. She was asking why, if he now says yes, federal support for prevention and recovery appears to be shrinking.
We're going to move now to the gentlelady from Connecticut, Mrs. Hayes.
Thank you. Good afternoon. Firearms are the leading cause of death for children and teenagers in the United States. Pediatricians, trauma surgeons, emergency physicians, and public health experts have repeatedly described firearm injury as a public health emergency. As my colleague stated, when you were asked during your confirmation hearing if you believe firearm violence was a public health crisis, you answered with one word: no. You went on to say, you believe that HHS can explore solutions for the behavioral health and substance abuse epidemic without compromising sacred rights and freedom. According to EdWeek, which measures school shootings at K-12 schools resulting in injury or death, there have been 26 school shootings since you were sworn in. According to the Gun Violence Archive, which measures any gun discharge on school grounds, there have been 240 incidents since you were sworn in. In 2026, we have seen school shootings in Rockland, Maryland, Detroit, Michigan, Crandall, Texas, Bulverde, Texas, Ferguson, Missouri, Oklahoma, Bethesda, Maryland. As you stated, I understand that you don't have full jurisdiction over the law enforcement side, the DOJ, the FBI. And since this committee has refused to respond to my request for a hearing on school shootings, I want to ask you about the things you do have direct jurisdiction over. HHS holds jurisdiction over public health aspects focusing on mental health services, trauma support for survivors, data collection to prevent gun violence. Since under your tenure, we've seen threats of cuts to SAMHSA, cuts to school-based mental health programs, cuts to the CDC staffers who work on research and prevention, cuts to bipartisan community violence prevention programs. They've been terminated. So, Mr. Secretary, since you were sworn in and now have full visibility of the harm of gun violence to children, has your position changed? Do you believe gun violence is a public health crisis?
I believe it's a public health crisis, but it's not. We don't have jurisdiction to
The things you do have jurisdiction over.
And we're doing those. So we're doing more studies on the etiology and cause of gun violence, the first that have ever been done in years.
Sir, I have to stop you.
And
I only have
right
5
now.
minutes, and I apologize.
You asked
but
the question, so I answered it.
Well, I want to know specifically why the research and the funding has been cut for these programs that address trauma, that address student survivors, that address school-based mental health programs for students who are affected by gun violence. You're putting out all of these programs, all of these studies about keeping kids healthy. Keeping kids alive is part of keeping them healthy.
And we're trying to do that by doing the studies to understand why people commit mass shootings.
But you've also cut funding.
That has not been done before.
You've also
It's
cut
been done
funding.
by the Trump administration.
Sir, I'm going to have to ask you to exercise some restraint. You're a Kennedy. You know how oversight hearings work.
Well,
and we
pretend
don't
you're
want the
asking
second graders to think that your interruptions are rude, disrespectful, or impatient. So I'm going to have to ask you to just allow me to finish my questions.
Well, don't pretend you're
In my
asking
home state of
questions. You're not gonna give
Connecticut,
me
where I was a
chance to
school
answer it.
teacher, in the classroom on the day 20 children were slaughtered and 6 educators, we worked really hard to see firsthand how to invest in our communities and provide prevention. Connecticut has created some of the strongest school-based violence prevention systems in the country through multidisciplinary threat assessment teams, early intervention programs, and partnerships that help schools identify concerning behavior. I put forth a bill, the School Violence Prevention Act, to begin to collect data to see how we can have federal programs to address these traumatic outcomes for kids. Many of the things that we fought for in the Bipartisan Safer Communities Act have been cut. So I have to ask you, what have you done to address the health of children? You point out so many other things about the food they eat, all these other things. What have you done to keep kids safe from gun violence outside of commissioning a study?
As I said, we have no law enforcement. Congress has not given us law enforcement.
I'm not asking you about law enforcement, sir.
What we do is we study issues and we study problems, and we're doing that with gun violence, which has not been done before.
Specifically, a study that you've commissioned.
We did it. We've done. I think it's almost near completion. We did a study on school shootings to look at what the shooters have in common, what medications they may have been receiving, whether they were on SSRIs, whether they were on benzos, and we're expanding that now across the agency to do even more of those.
The gentlelady's time has expired.
I'd like more information on that study because I'm unaware of it. I yield back.
Happy to provide.
Jahana Hayes brought something else into the room that day, lived authority. She told Kennedy she was a teacher in Connecticut on the day 20 children and 6 educators were murdered at Sandy Hook. That is not a statistic for her. It is memory. And that is why her argument hit with unusual force. To Hayes, prevention is not ideological branding. It is what adults owe children after watching what happens when institutions move too slowly, argue too long, or treat trauma like an abstract debate. Kennedy's argument is that HHS can study causes, and maybe it should. But Hayes's challenge is more immediate. Children do not live inside research timelines. They live inside schools, lockdown drills, survivor guilt, and communities trying to hold themselves together after another shooting. Her question was not whether studies matter. Her question was whether studies become an excuse for withholding urgent help. NPR also reported that SAMHSA, the country's main mental health agency, had lost more than a third of its staff and was being folded into a new HHS entity, while experts warned of lost expertise and weaker support for addiction and crisis systems. KFF's tracker likewise points to school-based mental health grant cancellations, proposals to reduce and reorganize SAMHSA, and rescinded community violence intervention grants as part of a broader policy shift. The real power of this moment is that Hayes refused to let the hearing stay procedural. She turned it moral. She made the country watch a cabinet secretary answer for what happens when Washington calls something a crisis but trims the very systems designed to absorb the damage. And in doing that, she exposed the central contradiction of this administration's posture on gun violence, an appetite for explanation, but far less urgency around care. Hayes's confrontation did not end with rhetoric. Her office says the School Violence Prevention Act would fund school-based programs for at-risk youth, trauma-informed care, community partnerships, and stronger violence prevention systems. Her public case is consistent. If lawmakers won't prevent every weapon from entering every school, they still have a duty to strengthen the systems that catch danger early and help children recover afterward. In Washington, viral moments disappear fast. But some exchanges linger because they reveal something bigger than a headline. Jahana Hayes' rebuke of RFK Jr. was sharp, memorable, and made for social media. But the reason it matters is deeper. She forced a public official to answer the gap between words and action, between acknowledging a crisis and funding a response, between studying dead children and protecting living ones. And that is why this hearing clip won't just be remembered as a put-down. It will be remembered as an accusation.